Hey guys, welcome back to the channel. My name is Omer, and I'm a doctor. My passion is to share valuable knowledge that can enhance and potentially save lives. My mission is to empower you with information that can make a real difference in the world. Welcome to today's video, where we'll be discussing an important topic that affects the health and well-being of millions of people: cholesterol management and the use of statins. Cholesterol plays a significant role in our cardiovascular health, and finding effective ways to manage it is crucial. So, whether you're someone who's been prescribed statins or just looking to better understand cholesterol management, stick around as we uncover essential insights in today's video. What is cholesterol? Cholesterol, a lipid molecule, is synthesized within the cells of your body, with the liver accounting for roughly 1/4 of its production. A certain amount of cholesterol is essential for maintaining overall health. Cholesterol is transported through the bloodstream by molecules known as lipoproteins. A portion of the cholesterol circulating in your blood is carried by low-density lipoproteins, LDL cholesterol. It is often referred to as bad cholesterol. Elevated LDL cholesterol levels in your bloodstream are associated with an increased risk of cardiovascular ailments. Conversely, a portion of the cholesterol circulating in your blood is carried by high-density lipoproteins, HDL cholesterol. HDL cholesterol is often referred to as good cholesterol, and higher levels of it play a role in preventing cardiovascular diseases. Factors influencing blood cholesterol levels. The level of cholesterol in your bloodstream is influenced by a variety of factors. While diet plays a role in determining cholesterol levels, it is not the sole determinant. Individuals who consume identical diets may still exhibit different blood cholesterol levels. Generally, reducing the intake of fatty foods in your diet can lead to a decrease in cholesterol levels. However, for some individuals, elevated cholesterol levels are linked to underlying medical conditions. Conditions such as an underactive thyroid gland, obesity, excessive alcohol consumption, and certain rare kidney and liver disorders can contribute to increased cholesterol levels. Hyperlipidaemia is a term used to describe an excess of lipids, especially cholesterol, in the bloodstream. In certain cases, exceptionally high cholesterol levels are hereditary and are the result of genetic abnormalities in the body's cholesterol production process. One example of this is a condition called familial hypercholesterolemia, where a genetic predisposition leads to extremely high cholesterol levels that run in families. Causes of elevated cholesterol levels. The formation of fatty deposits, atheroma, within the inner lining of blood vessels, potentially leading to cardiovascular diseases, is a risk that everyone faces to some degree. Nevertheless, certain factors can increase this risk. Some of these are lifestyle factors that you can change. These include smoking, physical inactivity or a sedentary lifestyle, obesity, unhealthy diet, consumption of a diet high in salt and unhealthy fats, excessive alcohol, treatable or partially treatable risk factors for which you require medication, high blood pressure or hypertension, high cholesterol blood level, specifically, elevated LDL, low-density lipoprotein, cholesterol is a risk factor, while HDL, high-density lipoprotein, cholesterol is beneficial for the body. High triglyceride blood level, which is another type of fat. Diabetes can affect cholesterol metabolism. Kidney diseases that impact kidney function. There are certain risk factors that you have no control over. These include strong family history, a history of heart disease or stroke in immediate family members, example a father or brother before age 55, mother or sister before age 65. Gender, being male. Early menopause in women. Age, increased risk as one gets older. Ethnicity, certain ethnic groups, such as people with family roots in India, Pakistan, Bangladesh, or Sri Lanka residing in the UK, have an elevated risk. Even if you have non-modifiable fixed risk factors, it is advisable to place additional emphasis on addressing modifiable lifestyle risk factors to mitigate your overall risk of cardiovascular diseases. Cholesterol blood levels and cardiovascular risk. Evaluating cholesterol blood levels is a crucial component of assessing one's risk of cardiovascular disease. For individuals with a low overall risk, the following cholesterol levels are generally considered desirable. Total cholesterol, TCHO, 5.0 millimoles per liter or less. However, it's worth noting that approximately 2 out of 3 adults in the UK have TCHO levels exceeding 5.0 millimoles per liter. LDL cholesterol, 3.0 millimoles per liter or less. HDL cholesterol, 1.2 millimoles per liter or more. TCHO/HDL ratio, 4.5 or less. This ratio, calculated by dividing TCHO by HDL cholesterol, takes into account that a higher HDL level is generally favorable for health, regardless of the total cholesterol level. For individuals at higher risk of cardiovascular disease, such as those with a history of stroke, it is recommended to target lower LDL cholesterol levels. It's important to recognize that the health risk associated with LDL cholesterol levels can vary, depending on factors like HDL cholesterol levels and other individual health risk factors. Therefore, a comprehensive cardiovascular risk assessment considers all these factors together. How much benefit you will get if your cholesterol level is reduced. For individuals at high risk of cardiovascular disease or those who have already been diagnosed with a cardiovascular condition, reducing LDL cholesterol levels can significantly decrease the likelihood of developing future cardiovascular problems. Lowering cholesterol levels. Transitioning from an unhealthy diet to a healthy one can contribute to the reduction of LDL cholesterol levels. However, it's essential to note that dietary modifications alone may not typically lower LDL cholesterol levels sufficiently to shift a person from a high-risk cardiovascular category to a lower-risk one. In cases where there is an increased risk of cardiovascular disease, medication, often in the form of statins, is commonly prescribed. These medications are effective at managing cholesterol levels and reducing the risk of cardiovascular events. Even at a low risk. Even if you are at a low risk of cardiovascular disease, it remains crucial to adhere to healthy lifestyle recommendations. Embracing these guidelines, which encompass maintaining a balanced diet, engaging in regular physical activity, abstaining from smoking, and consuming alcohol in moderation or refraining altogether, is vital. These practices will serve to minimize your risk of cardiovascular disease and promote overall well-being, helping to keep your risk as low as possible. Treatment. Statins and other lipid-lowering medications. Statins, a class of drugs, function by inhibiting a specific enzyme required for cholesterol production in the body. What are statins? Statins comprise a group of medications frequently prescribed to lower cholesterol levels in the bloodstream. Types of statins. Statins available by prescription encompass the following: atorvastatin, fluvastatin, pravastatin, rosuvastatin, simvastatin. Uses of statins. The decision to prescribe statins is typically made by your healthcare provider. Statins are commonly recommended in the following situations: high cholesterol levels, if you have elevated cholesterol levels, a condition known as hyperlipidemia. Atheroma-related diseases, statins are often prescribed when you have a cardiovascular disease associated with atheroma, such as angina or peripheral arterial disease. They are also recommended if you have experienced a heart attack, myocardial infarction, stroke, or transient ischemic attack, TIA, as they can help reduce the risk of these conditions worsening. High risk of developing atheroma-related diseases. In cases where there is a significantly elevated risk of developing cardiovascular disease, statins may be prescribed. Risk levels are assessed as a percentage, and a high risk is typically considered when your risk score is 10% or more. This indicates a 1 in 10 chance or greater of developing a cardiovascular disease within the next 10 years. Effects of taking statins. When you begin taking statins, a few important steps are typically taken. Initial blood test. Before commencing statin treatment, a blood test is usually conducted to assess your cholesterol levels and the functioning of your liver. Follow-up blood tests. After starting treatment, you will typically have follow-up blood tests within 1 to 3 months and again at 12 months. These tests serve to monitor the impact of the medication on your liver and to measure your cholesterol levels to gauge the effectiveness of the statin. Target cholesterol levels. For individuals without pre-existing cardiovascular disease, there isn't a specific target cholesterol level. However, national guidelines often recommend starting such individuals on atorvastatin 20 mg daily, which is considered a high-intensity statin. The goal with high-intensity statins is to lower your LDL, low-density lipoprotein, cholesterol, often referred to as bad cholesterol, by at least 40%. If you do have cardiovascular disease, the aim, if feasible, is to reduce total cholesterol, TCHOL, to less than 4.0 millimoles per liter and LDL cholesterol to less than 2.0 millimoles per liter. If these targets aren't met initially, your medication dosage may need adjustment or a different statin may be considered. For individuals with cardiovascular disease, atorvastatin 80 mg daily is often recommended as the preferred medication according to national guidelines. A study involving over 165,000 statin users revealed that approximately half of them did not achieve the desired 40% reduction in their LDL cholesterol levels. Various factors, including irregular statin use, may contribute to this. However, those not prescribed high-intensity statins like atorvastatin 20 to 80 mg daily were less likely to reach this target. After accounting for age and initial cholesterol levels, individuals who did not attain the 40% reduction target were found to be 22% more likely to experience a heart attack or stroke over the following 6 years. If you are taking a statin, you might consider discussing your pre-treatment and on-treatment LDL cholesterol levels with your healthcare provider. If your cholesterol has not reduced by at least 40% while on the medication, it may be worthwhile to have a conversation with your doctor about your treatment plan. Side effects of statins. Statins are generally well tolerated, with most individuals experiencing no or only minor side effects. It's advisable to review the information leaflet provided with your medication for a comprehensive list of potential side effects. Always consult with your healthcare professional or pharmacist to discuss the risks and benefits of any treatment. Common statin side effects may include headache, pins and needles, abdominal pain, tummy pain, bloating, diarrhea, nausea, feeling sick, rash, muscle damage, myopathy. This is rare. While some individuals taking statins have reported memory-related issues, studies have not established a link between statin use and memory loss. Do's and don'ts of taking statins. Muscle symptoms. Inform your doctor if you experience unexpected muscle pains, tenderness, cramps, or weakness. In rare cases, statins may lead to severe muscle inflammation, and your doctor may need to adjust your statin dosage to mitigate this risk. Contraindications. Do not take statins if you have active liver disease, are pregnant or planning to become pregnant, or are breastfeeding. Discontinue statin use if you develop liver disease. Grapefruit interaction. Avoid consuming grapefruit or grapefruit juice when taking certain statins, including simvastatin, atorvastatin, and levastatin. Grapefruit contains a chemical that can increase statin levels in the bloodstream, potentially intensifying statin side effects. Pravastatin and other statins do not interact with grapefruit. Medication interactions. Be aware that various medications, such as certain antibiotics and cyclosporin, may interact with statins. Dose adjustments may be necessary for either the statin or the interacting medication. When prescribed or purchasing another medication, inform the healthcare provider or pharmacist about your statin use to check for potential interactions. Chest symptoms. If you develop unexplained chest symptoms like shortness of breath or a persistent cough, consult a doctor. While extremely rare, statins have been associated with a condition called interstitial lung disease. Alternatives to statins. While statins are generally the most effective medications for lowering cholesterol levels, there are alternative drugs that may be used when statins are not suitable or are not adequately effective. Some of these alternatives include Bile acid sequestrants, examples include cholestyramine, cholcebolum, and cholestypol. These drugs work by binding to bile acids in the gut, preventing their reabsorption into the bloodstream and thereby lowering cholesterol levels. Bile acid sequestrants are sometimes used during pregnancy, as they are considered safe, whereas statins are contraindicated during pregnancy. Fibrates, these include bezafibrate, ciprofibrate, fenofibrate, and gemfibrozil. Fibrates are primarily used when there are high levels of triglycerides, another type of lipid, either with or without high cholesterol levels. Ezetimibe, often used in combination with a statin or as a standalone medication, ezetimibe hinders the absorption of cholesterol from the gut. Bempedoic acid, this medication is used, especially in individuals who do not respond adequately to other cholesterol-lowering drugs. It is also available in combination with ezetimibe. Fish oils, natural sources of fish oils, such as oily fish, example mackerel, may help reduce blood lipid levels. Dietary recommendations often include consuming at least 1 to 2 portions of oily fish per week. Fish oil supplements, containing omega-3 fatty acids, are also available, though their efficacy is still a subject of debate due to unclear evidence from research trials. Inclisiran, alirocumab, and evolocumab, these drugs have been recommended by the National Institute for Health and Care Excellence, NICE, as options for reducing cholesterol in patients with high cholesterol levels that do not respond to statins or ezetimibe. Icosapent ethyl, recommended by NICE for individuals already taking a statin, having controlled LDL cholesterol levels, having high triglyceride levels, and being at a high risk of cardiovascular events. This medication has shown evidence of reducing the risk of cardiovascular events in this specific group of people. It is essential to consult with a healthcare provider to determine the most suitable cholesterol-lowering medication based on individual needs and health conditions. Conclusion. It is important to note that while statins can be a valuable tool in managing cholesterol, they should complement, not replace, lifestyle modifications aimed at reducing the risk of cardiovascular disease. Maintaining a healthy lifestyle, which includes not smoking, maintaining a healthy weight, adopting a balanced diet, engaging in regular physical activity, and consuming alcohol in moderation, if at all, remains essential for overall cardiovascular health. And that's it, guys. We have covered a lot of useful information today. I hope that this information will be a helpful resource for either you or someone you love. As a full-time doctor, my goal with this channel is to share my medical knowledge with all of you to help improve your overall health and well-being. If you found this video useful, please consider subscribing for more helpful content just like this. I'll be publishing a new video every week, so if you have any suggestions for future topics, please leave a comment below. Until then, take care of yourselves and stay healthy.